David Johnston.
Thank you very much, Madam Deputy Speaker. I campaign a lot in this House about young people, having had a career working with them before I got here. I campaign a lot on the environment, which is important to me and to many of my constituents. But the biggest thing I campaign on in this place is infrastructure, and not having the infrastructure for the number of houses and the population that we have in the constituency. And whether those campaigns are about reopening Grove Station, something my constituents have wanted for over 50 years, whether it's about better broadband in certain parts of the constituency, whether it's about our roads, because most visitors to Oxfordshire and most residents like myself feel the roads in Oxfordshire are more pothole filled than almost anywhere else we go in the country. We have two important roads in my constituency, the A420 and the A34, which both have significant safety concerns. Indeed, the last time I had a debate of this kind was on the A420 and A34. But the number one infrastructure issue in my constituency is access to health services, particularly to GP surgeries, as well as to dentist surgeries as well. And so for 6 or so weeks, I had a survey for my constituents for them to tell me about their experience of accessing health services. Nearly 3,000 people completed that, which I'm very grateful to them for doing. And over 3/4 of them said that they had found it difficult to get a GP appointment in the last 12 months. That was significantly higher, actually, than getting a dentist appointment, though the dental appointment figure was also high at 44%, which is far too high. The issues with dentistry are slightly different to GPs. But only 1 in 10 of the people who completed that survey said that they had had no trouble accessing health services. And 5% actually hadn't tried to in the last 12 months and so weren't able to say whether it had been difficult or not. And overwhelmingly what came over and over again was we need more GP surgeries, we need more dental surgeries. There are other services people would like to see, like more mental health provision, more physio provision, and so on. But those two were by far the biggest. And the situation is most acute in Didcot. Now, I live in Didcot, and there have been huge numbers of people that have come to live in Didcot over recent years. We have one estate, Great Western Park, which is a 3,500 home estate, which was promised a GP surgery and 8 years later is still waiting for it, with absolutely no progress having been made. Meanwhile, we have a new development coming called Valley Park, which is going to be 4,200 homes, right on the border of Didcot, so it will add a lot of pressure there too. And yet we've still seen no new GP surgeries. Those two estates alone will add about 18,000 people to the population in that area, which is more than enough to fill a GP surgery. And yet we continue not to see any progress with it. So of course we've had a post-COVID problem with having encouraged people not to use NHS services if they could provide it, not go to their doctor if they could avoid it. And we've got that backlog to deal with. But we had an issue long before this as well, where the infrastructure has not kept pace with the population growth. Now, the politics of this is that we have Liberal Democrats running every part of local government. They run both the district councils in the seat that I represent. They run the county council in coalition with Greens and Labour. And of course what they say is this is all the government's fault. But of course they have been in charge of one district council since 2019, the other one in coalition with the Greens since 2019. So it isn't good enough just to say, well, it's all the government's fault. And what we've got to try and get to is a better system of accountability for local council leaders, local health leaders, and it is partly the government, it's about the government training more doctors. And I very much welcome all the things the government is and is, will continue to do in this area. We are training more doctors. We've got 2,200 more doctors than in 2019, further 4,000 plus who've taken training places to become doctors last year. I think the increase in appointments is very much welcome, 2 million more in March this year than in the year before, an investment to get 50 million more appointments by 2024. And the recent announcements on tackling the 8 a.m. rush very much chimes with my inbox, because over and over again my constituents write and explain to me how frustrating it is to ring at 8 a.m. like you're advised and to not be able to get through. The record number of times someone has told me so far that they have called is 117 times. There are other people who've called 89 times, and just huge numbers of ringing over and over again and getting very, very frustrated, and eventually contacting me to say they don't know what to do because it doesn't matter how often they ring, they're not able to get through. So what the government's doing there, on saying that actually when you ring, you will get referred to an appropriate service, perhaps 111, perhaps a pharmacy, and you will not need to call back, is also something that I very much welcome. And by the way, I also welcome the increased role for pharmacists, because I think it's absolutely right that they ought to be able to give out the oral contraceptive pill, to be able to give out medicines for sore throats and earaches and things like that. They are well equipped to do that, and that will help to ease some of the pressure on the GP surgeries. Because it isn't the fault of the existing GP surgeries, the situation that we find ourselves in. In fact, I asked the existing GP surgeries to help promote my survey, and many of them did so because they are feeling this pressure. We've had several surgeries close their books temporarily because they simply were unable to take on many more patients. And this, of course, affects everybody's quality of life, because people who already lived there, who used to find it easy to get an appointment, no longer can, and people who've moved to a new area and hope to be able to register with a doctor find that they're unable to do so. And this is one of the most important services that we could be providing for people. So what I would like to see, and my honourable friend knows that because I'm the PPS, the Secretary of State for Levelling Up, I'm going to swerve housing and planning policy, because that's not something I should be talking about in that role. I know the rules, but I think what we need is a couple of things. One is a much better accountability mechanism for local councils, local health leaders to plan for population increases and then deliver services as that increased population happens. Government can and will train more doctors, but we are making promises to local people about what's going to come with increased numbers of people, and those promises never arrive, and then they stop believing in them. And people who actually weren't opposed to new houses because they realize that people need somewhere to live and their children and grandchildren are maybe struggling to get on the ladder, become people who are resistant then to more houses because they've seen so much arrive without being able to get the services that go with it. But the other thing is, which is important to me and may feel like a side issue, but I think is actually fundamental to this, which is that, my pre-politics career was running charities for disadvantaged young people and promoting social mobility. And the medical profession is the most socially exclusive profession in the country. Only 6% of doctors come from a working class background. You are 24 times more likely to become a doctor if a parent is a doctor. And it's been that way for some time. And actually, as an outsider, the situation seems to get worse, because very recently, the BMA junior doctors passed a motion to cease apprenticeships into medicine, which are supposed to help widen access to it, and which every other profession pretty much now has got some form of apprenticeship to try and widen access. And the BMA's junior doctors have passed a motion saying actually they don't want these. Now, that, given the state of the profession, given that to me it in no way reflects the country's talent for all sorts of reasons. I used to work on this. It's about access to work experience, recruitment methods, and so on. But that's a very retrograde step when the profession is the most socially exclusive in the country. And given we have a shortage of doctors in particular areas, it seems mad to me that in a profession where the application ratio is at least 10 to 1, and I worked with so many disadvantaged young people for whom this was their dream career. It was actually the most popular career at one charity that I ran, that we are not making better use of that talent, because I feel sure it could help ease some of the pressure that we're seeing, not just in my constituency, but in others. So, in closing, you know, I say to my honourable friend that I very much want to meet him to discuss how I can bang heads together and make progress to see that we get things delivered. It's a shame it's not within an MP's control to be able to deliver new GP surgeries and so on, but I want to work with him to work out how we do that and possibly have a health hub within my constituency, because this is something that, this is not the first time I'm talking about this. I've talked about it more than 20 times, and it will not be the last time I talk about it either, until my constituents get the health services they deserve.
Madam Deputy Speaker, thank you. I should start by congratulating my honourable friend for Wantage for securing this very important debate. He mentioned in his remarks that there are limits on what he is allowed to say about certain aspects of this, particularly about how we marry up new housing with new GP surgeries. There are limits on what he can say in this chamber, but none of us in government are in any way strangers to his very, very strong views on this subject, and the amount of work and campaigning that he's done on this issue is formidable, so I pay tribute to him for that. Now, I absolutely recognise the struggles that the honourable members' constituents have reported in his survey of getting an appointment with their GP or dentist. Despite the efforts of general practice teams, who are now delivering something in the order of 10% more appointments every month than they were pre-pandemic, which is the equivalent of about 20 more appointments per working day per surgery, demand is rising. We've got about 30% more people over the age of 70 than we did in 2010, and those people tend to have about 5 times more appointments than younger people. So because of the ageing society and the effects of the pandemic, demand is rising. And that is why we have listened and why we've taken action, including just last week when we published our primary care recovery plan in order to address some of those concerns. Now, our plan is ambitious, and it will modernise access to general practice, the front door of the NHS effectively. We want to end the 8 AM rush for appointments and ensure that patients know how their requests will be handled the very first time that they contact their practice. And to achieve that, we're investing the equivalent of £6,000 per practice to provide new technology, including modern digital phone systems so that people don't get engaged tones, and easier digital access too, so that many more issues can be dealt with online at a convenient time for the patient. Also freeing up phone lines for those who do need to call so that they always get through easily. We're also, as my honourable friend mentioned, expanding the role of community pharmacies in delivering primary care, investing up to £645 million to enable pharmacists to provide treatment for common conditions. Pharmacists will be able to supply prescription-only medicines and start courses of oral contraception for the first time. That will provide more choice for patients and be a convenient way of getting treated, but it will also reduce the pressure on general practices, freeing up something in the order of 10 million appointments a year, again making it easier for my right honourable friends' constituents to get through. We've started consulting with the PSNC already with a view to introducing this new service, a completely new NHS service, by the end of the year. And we're continuing to cut bureaucracy to reduce the time that's spent by GPs on work that is not work that they need to be doing. The plan frees up about £37,000 per practice by cutting back targets and improving communication between GPs and hospitals, something that's been raised with me many times by GPs. But of course we need to deliver more appointments, and there's one thing we need to do that, which is of course more staff. And I'm pleased to say that today, this is the actual day on which we have managed to deliver ahead of schedule our commitment, our manifesto commitment to recruit 26,000 additional staff into general practice. That's happened ahead of schedule, and those extra staff are helping to deliver the 50 million extra appointments that we promised by March 2024. It's through both the additional staff that we've invested in and the very hard work of general practice teams, which I pay tribute to, that they are already delivering that 10% extra number of appointments compared to 2019. The recruitment and retention of general practitioners remains a really big priority for us, including for our wonderful experienced general practitioners. And that's why we're helping to retain senior GPs by reforming pension rules, the number one thing the profession were asking us for, lifting about 8,900 GPs out of annual tax charges. Now, my honourable friend quite rightly raised some very specific concerns about the provision of adequate services to meet the needs of new housing developments, something which is of course an issue in particularly desirable and fast-growing areas like my honourable friends. I am very, very seized of this as a crucial issue, and we are working on it in real time. Just last week we announced that as part of the GP plan, we would be, through the National Planning Policy Framework and planning guidance changes, making a series of reforms in order to make sure that new housing always comes with the GP surgeries that are needed. So first changing the NPPF and planning guidance, and even before that, updating the planning obligations guidance to ensure that primary care infrastructure is addressed by local planning authorities, just as they do for other infrastructure demands like education. And on top of that, government will also update guidance to encourage local planning authorities to engage with local NHS, the local ICBs, on large sites which might create the need for extra primary care capacity. My hope is that a bigger chunk of the 7 billion a year that we are spending, or rather raising from housing developers, will flow into new primary care facilities. But as my honourable friend mentioned, local authorities have an absolutely unavoidable and crucial role in enforcing the delivery of the commitments that developers make, and ensuring that as they make their local plans and enforce those local plans, that they ensure that what is promised is delivered, and that wherever there is planned new development, they are planning alongside that for the infrastructure that is needed. That is something that local authorities absolutely have to deliver for their constituents. I'm sorry to hear that there seems to be some trouble with that in my honourable friend's constituency. My honourable friend also mentioned challenges with dentistry. That is also something that we are working on very actively. We'll be publishing our plan for dentistry shortly. The reforms that we made some months ago to enable dentists to do more, to do about 110% of their contracted work, to split up the bands so that dentists are paid more fairly for the NHS work that they do, have been received well by the profession, and in March there was about a fifth more people seen by dentists, NHS dentists, in the year to March compared to a year earlier. So we're starting to make progress, but we know there is more to do. And to reassure my honourable friend about his question, we will be publishing our dentistry plan very shortly. But I thank the honourable member not just for his thoughtful speech today, but all the work that he's been doing campaigning on this ever since he was elected. He always makes a powerful case, both in this chamber and behind the scenes. He has many thoughtful ideas that are already influencing government policy. So I pay tribute to him for his work, and I hope that his constituents will soon be able to see positive changes as part of our recovery plan.